Death is something that we know that one day it will come, yet few people truly understand what it is. What really happened when a person is dying? What are the signs and what are the stages of death, or what are the stages that the body goes through before the life comes to an end? In today's video, I'll gently explore the stages of death from the first physical change to the final moment, so you can understand the process with compassion, not fear. Whether you're a healthcare provider or you're a professional healthcare, a student, or someone who lost a loved one, this knowledge can help you see death not as something that is not normal, but as a natural part of life. So the first stage of death is denial and isolation. When someone learns that they are dying, the first reaction is often denial or isolation. They might say, no, this can't be true. It is not happening to me. But just know that it is a natural defense mechanism, a way for the mind to protect itself from overwhelming fear. During this time, the person may withdraw, avoid talking about their condition, or seek multiple opinions, hoping for different answers. As a caregiver or as a healthcare provider or someone you love, it is important, if you're taking care of someone you love, it is important to offer quiet support and allow them to process the reality at their own pace. If you are taking care of a patient and a patient tells you that they want to be alone, please allow them to be alone so that they can process what is happening, so that they can ask those questions by themselves. Whether they will get answer or they will not get answer, that should not concern you. But if they request, they want a peaceful moment, a quiet time, please allow them to go through that moment without interference. Don't question them too much, because most of the time you get that people who go through this process is, of course we know everyone will die, and we know that everyone will die at their own time. We don't pray for death. Everyone doesn't want death, but at least most of the time, you will get to learn these stages from a person who is having a chronic condition. Yeah, a person who is having a chronic condition usually go through these stages, and you can notice. So when they are in their first stage and the first stage of denial, you will find them asking questions which you don't even have answers. Someone will ask you, maybe let's say for example, this person is having maybe a cancer. They will ask you, or they will just ask, is it really true? Maybe sometimes the doctor has told them that their condition is not long lasting. When they get such messages, they usually ask themselves a lot of questions. So they might want to isolate themselves. So please, if they ask, just make sure they are safe and give them or provide them with that space. The next stage is anger. Once the truth sink in, once the doctor has broken the news, once that nurse has broken the news to the patient that they're having a terminal illness, the truth starts to sink deep into their mind, into their heart, and anger can surface. The person might be angry with themselves. The person might ask, why me? Or express frustrations towards doctors, towards nurses, towards family members, or even God. The stage is often misunderstood. You will get that some doctors or some healthcare providers saying that the patient is stubborn, the patient is frustrating them, the patient doesn't want treatment. They fail to understand or recognize the process of death. But it is actually a sign that the person is starting to confront the situation. Your role as a healthcare provider or as a caregiver is to stay with the patient, listen to the patient. Don't take the anger personal. The patient might abuse you. The patient might say some hurtful words to you or to the doctors or to the family members. Don't take this personal. It is just a process of death. The process of death is taking place. Give the patient that moment. Stage 3 is bargaining. These stages are more or less the same with grief stages. That is why I started with grief and now we are in death process stages. So stage 3 is bargaining. In this stage, the person begin to bargain, trying to regain some control. They might make promises such as, if I can live a little longer, I'll change my ways. They can say even, please God forgive me more time. Please God forgive me. Please God give me more time. Those are some statements that you will hear a patient is making. Bargaining reflects hope and desire to find meaning and purpose before the end of life. Support them by encouraging open conversation about their fear and unfinished wishes. This is the time you can tell them to maybe write a will if they can, if they have not. Give them that moment of, give them the room to ask those questions. Ensure you provide you engage in an open conversation so that you get to understand what are the patient's wish before they die. Number 4, or stage 4, is depression. I said they are more or less the same with grieving stages. So in stage 4, as reality deepens, sadness and withdrawal often follow. The denying person may feel tired, lose interest in daily life, or express sorrow about leaving loved one behind. This depression is not something to fix. You cannot fix it. It is a normal emotional response to loss. Comfort, show empathy, provide your presence. And remember, empathy means more than words during this time. And you can never fix depression at this moment. This is a natural process. Stage 5, which is the last one, is acceptance. Finally, the patient accepts a peaceful readiness for what is coming. The person may want a quiet moment, spiritual reflection, or say goodbye to loved one. The person acceptance doesn't mean they have given up. It means they have found peace. They are ready to face death. It is a phase, or it is a stage where fear fades and calmness set in. They understand the stage. Some of them will tell you to they want a pastor or a priest to pray for them for the last moment. Some of them, if their children are away, they will request their children to come and be with them for a few moments before they die. Some of them will want a quiet place so that they can reflect about everything or how they lived. Yeah, it is a normal process. Death is not just an end. It is a transition. Understanding these stages help us care better for those at the end of life and also help us face our own mortality with compassion and grace. If this video helped you understand the process of dying, don't forget to like, share, subscribe for more nursing and health education content. Tell me which video you want me to post next and I'll abide to that comment. So let's meet in the next video. Bye till next time.